Thank you very much. I would like to call the August 4th meeting of the Select Board to order. We do have one disclosure from the Governor's Office. Would like to read into the record.
Thank you. Good afternoon. This open meeting of the Town of Sutton Select Board is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. The Governor's orders suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. The order allows public bodies to meet entirely remotely so long as reasonable public access is afforded, so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such public participation is required by law. This meeting will allow public comment through the comment section. For this meeting, the Select Board is convening via the Zoom app as posted on the town's website, identifying how the public may join in. Please note that this meeting is being recorded, so accordingly be aware that other people can see you, and anything that you share on your screen will be part of the recording and will become part of the public record.
Thank you so much, David. I appreciate that. Next item on the agenda is our public forum. This is limited to 5 minutes per topic. Discussion or comments about town employees or agency members shall be avoided so as to not violate any individual's rights. Do we have anyone for public forum this evening? Being none, we will move on to our next two items under minutes. First is the Select Board minutes from July 21st. So everyone had an opportunity to review them?
I move that we accept the Select Board minutes of July 21st, 2020 as presented.
I'll second that.
Okay. All those in favor of accepting the minutes from July 22nd, please indicate by saying aye.
Aye.
Aye. Thank you. That passes unanimously. Second on our minutes are the minutes from our Select Board goals and objectives from our July 28th meeting.
I move that we accept the Select Board goals and objectives minutes of July 28th, 2020 as presented.
Second.
I lost everybody there for a minute. Everybody froze for a second.
Second.
Oh, the whole meeting's set.
Okay. All those in favor of the motion to accept Select Board goals and objectives meetings, please indicate by saying aye.
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 Aye. Thank you so much. First agenda item, we have Cheryl here to give us an update on the COVID-19 situation. So Cheryl, I'm gonna turn the floor over to you.
Okay, thank you, everybody. First of all, just basically from February 1st to present, when the pandemic began, the Board of Health was considered an essential service. So we were in full operation for Board of Health during the pandemic, which was more or less COVID related. And it was basically with the Board of Health aspect of it, we were still doing septic plans, water, food, burial permits, and all those things like that. And we had to adjust our procedures to accommodate for the remote services now that since the town hall was closed. Also during that time, since the beginning, when the pandemic first started, there was an awful lot of information that needed to be found out and this and that we were notifying first responders who had a lot of questions, who were the first people to be tested, and a lot of the first responders came looking for us to give them answers or the results of their test. So with a lot of that, we had to do a lot of clarifying interpretation and also guidance as far as campgrounds went, dog golf courses that were all looking for guidance during this time because the stay-at-home order was in place. But when the phases first started coming out, there was a lot of unknown, needed a lot of clarification, things like that. During this time, before we even started the cases, and when the cases first started coming in, conference calls were beginning as far as webinars, trainings, updates, and those take about 15 hours a week, and they've been ongoing since the beginning of March. Also, with the cases that started rolling in March, I more or less did them myself. And then when they really started expanding, I was able to utilize the school nurses from all the surrounding towns. So I had trained an awful lot of people, got them on what we call the Maven, which is a virtual gateway, which is our online confidential reporting system. And that's where all our COVID cases were investigated, contact tracing was done, and follow-up. And from start to finish, each
I feel
case
like I just froze again.
takes about 4 hours. And so there was a lot of work with that, a lot of communication between other towns, other health departments, things like that, because there was a lot of employers, family, things like that. Basically, right now, things started slowing down a little bit. Unfortunately, there's been a little uptick in the past couple weeks, and that's been due to the good weather. A lot of people, I think, have a little bit of quarantine fatigue and things like that. A lot of lack of social distancing and not wearing of masks. So we've had a lot of clusters involving people in their 20s and their late teens, things like that. But again, we're just trying to get people just to be responsible for their actions, to try to minimize the best that we can, and as a community as well as a Commonwealth, to really kind of flatten the curve and to also prevent any further spread of the disease. Some of the other things that I've been involved with over the past month or so, I've been working very closely with the school, with the plans for reopening. The state has set guidelines and deadlines to have different styles of learning for school. And I've been involved with Mr. Friend and a lot at the school regarding practices with the nurses also, of what to do with different types of learning, what to do with sick children, symptoms, things like that, and also how it affects the school, how it affects the community, and how it affects individuals also. As cases had gotten, had changed and starting to increase, there was more leeway given. And so now food establishments have been able to open. We had to review plans. We had to go down and do site inspections and make sure that there was distancing requirements, setup requirements, and that their menus and everything else corresponded. So they had to still maintain their food code, plus also be safe and have a COVID response plan to self-certify themselves. Sports have started. Baseball has started for youth, and there was a lot of guidance, and that we had to go out and explain to the coaches what we expected, things like that. And I will say that I had to speak with an older baseball league in town that was using town property, that they weren't social distancing and things like that. There are now signs up on the baseball field there. The basketball courts are still upright. There are sports that are not allowed because they're high contact, high risk sport. And those are a lot of the fall sports: baseball, soccer, lacrosse, hockey, things like that. I know that there are a lot of people that are interested in just doing some drills, but we've been noticing that we have been seeing an uptick in some of those people that have been participating in those activities, that there was some spread of the disease there. So we're really looking at that. And I know the governor is on, and he's very concerned about the little uptick in the cases right now. Other than that, been enforcing masks, which was a mandate that the governor had put on us. We don't want to fine, but we've been really investigating some food establishments that have not been very cooperative with wearing masks as employees. I had to go down and speak with some of those people, and there was compliance now.
That's just what it keeps doing.
And the same thing with, now there's a new travel mandate. So that's another thing that the Board of Health is required to follow up on. There are a couple of people that I have already received information from that they have to quarantine for the 14 days because they've come from a considered hotspot, which is out of the New England area. And other than that, that's about it. PPE is a little concern. Some of our patients that we've been seeing, I've actually had to go out and deliver some PPE to them. And that has been a little taxing because we really don't have an awful lot. We're still trying to get some PPE within the department, and we've been working on a few places right now, and so those are just waiting for that. There are a lot of posters around for social distancing, face masks, things like that. And basically what we're doing is that we're telling people that if you're really not feeling well, please stay home. Please follow the guidelines. And unfortunately, the guidelines are changing frequently, and we say it's a very fluid situation because one day it can be this way and the next day it changes back and forth. So that's been kind of challenging sometimes because a lot of people don't understand some of the guidelines that we have to explain. Most of the camps have closed. There are no day camps that have happened, so there was no inspections for camps that needed to be done other than there is a camp that we have in town that is looking to open. So we'll have to check, see how that, also having a re-inspection next Monday. And that for, just to get you some statistics from the town from February 1st through today, we've had a total of 55 cases in town. And those are confirmed cases. The state does not consider cases that we do investigate that they revoke them or they consider them suspect or their contact. So those are cases that we all work on, but they're not considered, they're not counted as confirmed cases within the state. But other than that, things have been fairly quiet up until this week. We got a big influx of 6 cases in the past 3 days, and they were all young people, and a couple of them are little clusters of people that were getting together. So we're just trying to enlighten people and educate people the best we can. So basically, that's
so much,
about it.
Cheryl.
I don't know if anybody has any questions that they can answer. I know I'm all over the place, but it's just been a little bit of the things that we've been doing. And that's about it. Does anybody have any questions that I could answer for them or?
I don't. Yeah, sure. I'm sorry. We're just having some technical issues over here we're trying to work through. David, did you have any questions or comments?
Certainly. Thank you. Cheryl, thank you. Thank you for coming in today. I think, I suspect you're going to hear this a lot, but thank you for everything that you've been doing. This has been, I would imagine, listening to other health professionals, starting with Dr. Fauci and working their way down, that this is probably the most challenging public health issue that you've faced in your career, I suspect. I don't want to speak for you, but that's what we're hearing. And I know it's been a lot of work, so we certainly appreciate all of the effort that you've put in. So, you know, the first question that comes to mind for me is that we have these intermunicipal agreements with 11 or 12 towns.
Mm-hmm.
And so all of the work that you're performing for the town of Sutton is being duplicated across all of these towns that you're working on?
Correct. I have nurses involved that are also working.
So when you talk about Maven and 4 hours worth of work in terms of putting it all in and talking to probably the patients and then doing all the contact tracing, that was work that's been able to kind of been, I'll say, delegated off to other people. You don't have to do that for all of the patients across all of these towns.
That's correct. It's all spread across.
So so were each of these towns essentially able to provide some kind of nursing assistant for you, or were these people that you were kind of gathering to help you out?
A lot of them was school nurses. So during the time when schools were closed, the school nurses were all very eager to chip in and participate, and trained them all, got them all access to Maven, which encountered taking courses and being approved by a source, which was me. And so those towns were all staffed by nurses. So I didn't do all the cases.
Yeah.
There was a total of between 8 and 10 nurses, and they stayed on till the end of June.
Sure. Dave, do you mind if I interrupt them? I would like Cheryl to kind of talk a little bit about the grant that we received through Charlton and their health director. And it sort of, in some ways, duplicates what the IMAs have. There's similar communities involved in both of these grants. So Cheryl, do you want to talk a little bit about that grant in Charlton and how we got that and what that means?
So the state had given money to municipalities for public health nursing and the boards of health in COVID response. Unfortunately, you had to group together because they didn't want to give them to individual towns. So that's how the Charlton group got together, and they were most of the towns that we had already had intermunicipal agreements with. And so a lot of the funding that we received for reimbursement came from this grant. And so there was just one town of all the other towns that we had that didn't, that all the nurses participated in all the other towns except for one, and it was a small town. So it really did not have much impact on us at all.
And the nature of the costs that were covered were the costs of the nurses themselves, maybe even your time. These are
Everything was covered, as well as we had a work environment, which is over at the high school. And Mr. Friend and Mr. Smith were very generous and gracious enough to allot us to use the high school nursing office, which every nurse had their own private office, computer and everything else. So they all had their individual towns and they worked there. Or the other nurses that worked in the other towns worked in their school districts on their municipal computers. So it really worked out very well, and everything was reimbursed. I think Tim and I and Judy have been working on all the figures. So all the cost has been, there's been nothing that has come out of our pocket.
So Tim, did we run all the costs through here because of the IMA? So we sort of bore the cost to begin with, and then collected the money from the grant. Is that?
Well, there was a couple pieces, but mainly it was time records, and Judy was the one behind the scenes gathering all that information, putting it into spreadsheets, and then allocating time based on the number of cases per town. And that's how the billing was done monthly. And we set up a separate account to bring in the the money from the various towns, all part of this big regional grant. And then I've spent time reallocating expenses over to that same grant account.
So in addition to everything else that's going on, it's been a lot of other record keeping kind of work in the accounting office to keep everything kind of straightened out. I mean,
Yeah, we're trying to make sure that should the day come that the state decides they want to audit what we have, that we're going to be okay. So we're working real hard trying to make sure we cover all our bases.
Because there's also some school grants we've heard about where just allocating costs to the right place, so tracking and allocating is a big issue. So thanks, Tim. So Cheryl, would you describe your role as like in addition to just health guidance, do you think of yourself as a compliance officer, if you will, on behalf of the state?
Yes, as a matter of fact, I think the local boards of health have all been delegated the responsibility of a lot of the guidances that the governor had addressed as far as information, as far as the different phases and the opening up of the Commonwealth, things like that. And at each step and each phase, there was new guidance that was going, and like I said, it was very fluid. So one day it was this, and the next day it would change to something else. So that was very important to attend, not to attend, but to listen to the conference calls, the trainings, the webinars.
Good.
Like I said, they're about 15 hours a week of all that, plus the training on Maven and the training that I had to provide to the nurses to get them up to speed and to show them how to conduct disease investigations, surveillance, and contact tracing. So I played a role as far as bringing the nurse on board and being as a leader, I'd say, and as a resource for them myself if they had any questions about certain concerns or questions they may have had.
Tim?
Cheryl's being gracious. Cheryl and I were on a conference call the day that is he the town administrator, Jim Philbrook?
No,
His title?
health director for the town of.
Okay, so he's the health director. He put together the grant, put all the towns together that are going to be covered by this regional grant. And before he was ready to pull the trigger, he wanted to make sure that Cheryl and I were on board, that we could handle it, and that he wanted to make sure that everybody knew Cheryl was the point person, that she was going to handle all the towns that were in this regional grant. She was the leader of the whole process. So Cheryl, not giving herself enough credit, she had to learn everything and then train everybody, and everything. She was the point person.
Thank you, Tim.
Which means that we had, you mentioned restaurants before that you had some compliance issues with. And was that also the kind of thing you did across all these different towns? And what about like the restaurants are kind of like the public face, the retail type establishments, but there's certainly lots of non-retail establishments that also had their own set of protocols they had to deal with. Did you have to deal with all of those?
The only nursing was the one that we had encompassed all the regional stuff. As far as the restaurants, the campgrounds, the golf courses, the dog groomers, that all was just for the town of Sutton itself.
Okay. And did you have a lot of that kind of work to do besides restaurants, dealing with compliance issues with across the whole swath of businesses that we might have?
Yeah, because there was a lot of misunderstanding. They didn't understand the guidances. They didn't understand the number of people. They were trying to, everybody's trying to just do the best they can just to try to get back on their feet. And we had to just, re-educate them, explain to them and things like that, and reinforce things. And there was a couple times I had to go down to a few places where, they had too many people in a restaurant. They should not have had anybody in, but things like that. But again, it was just more or less explaining, and they knew and when they realized and understood the guidance, they were cooperative and they complied.
Yeah, I should mention that, for my own work here, I actually called Cheryl with a question that I had at one point, just clarification on some of the rules. So thank you.
Yep. No, we've had a lot of those, Dave. We had a lot of companies call with concern about positive cases, and a lot of people, tattling on people, and a lot of misinformation. So we had to do a lot of explanation and reassurance in that aspect.
Well, as you said, it was very fluid. It is very fluid and still and confusing. So
it is.
I guess, last question, I have a lot of questions, but I'll turn it over to my colleagues. Last question I have is really about the rise in case counts that we're seeing now.
Yeah.
Just, I don't know if you have any comments about where you think this is headed, and I don't know. That's an open-ended question, so.
Yeah, well, to the best of my knowledge, and this is what I'm just saying from my own personal, since I've been dealing with this for the past several months, it is starting to pick up. We had a nice lull probably a few weeks ago, and we kind of thought that things were going good, and the hot spots were down south and along the West Coast, things like that. But what's happening is that it's the summertime. There was a lot of partying going on. The graduations were happening after the fact. And, you know, people they want to socialize and get together. And unfortunately, that's when the guards, you know, and the walls go down, the guards go down, and the masks come off. And that's what's been happening. So that's what I've been seeing as far as the cases. A lot of the cases I've had, my range of cases, I had a 7-month-old going to a 95-year-old. So, and everything in between. A lot of the young kids have no symptoms, called asymptomatic. The teenagers that I'm seeing now, couple little minor symptoms, but what they're doing, they're bringing it home to their parents who are much sicker. And if they're in multi-generational families, grandparents are even in worse shape than that. So that's what we're trying to stop. But we see the clusters of friends, cohorts together that are popping up, and then families are affected after that, and it kind of snowballs from there. So I do see it a little bit, but my big concern is in the fall, is that, you know, with college kids coming back into the area, if there's going to be colleges, school, what's going to happen with school? I know that's a big concern. I think there's going to be another surge, and I think we're kind of expecting it. We're all kind of preparing for it, which leads me to another issue, is that as the town of Sutton is part of Region 2 Public Health Coalition, it's part of a 74 regional coalition, and that's what we've been doing for the past, I'm going to say, I can't tell you how many years that I've been involved with it, is that we drill and we prepare for emergency preparedness. And, you know, being involved with H1N1, we continue to drill, have setups and things like that. So I'm ready for anything. I use our flu clinics as a setup drill. I've been involved with H1N1, Jim and I, back in the day, many years ago, back in 2009. And because there's such a shortage of public health nurses, we assisted in a lot of communities, and it's hard because there's a nursing shortage and even a significant shortage of public health nurses. So we're just trying to be prepared for that aspect also, be mindful, as well as trying to minimize everything.
Well, again, we certainly appreciate everything you've been doing, and I know you've been working hard. So I'm sure my colleagues all have questions. So, Madam Chairwoman, I'm all set. Thank you very much.
Thank you so much, David. And before we move on to Jesse, I just wanted to apologize. I've had to relocate. I had some connection issues. So I'm now the town of Sutton. That being said, Jesse, do you have any questions or comments for Cheryl?
Yep. Thank you, Madam Chairwoman. Cheryl, first off, I'd like to echo Dave in his thanks, but I'd also like to add to that, if I could, everyone in town who's on the Board of Health, as well as Judy, who I know is your sidekick, and I know you couldn't do all you do on a given day without her assistance. So thank you to everybody who's been keeping you straight, as it were.
I don't know about keeping it straight.
All right. I do have a couple of questions, if you don't mind.
Of course.
First off, you mentioned earlier that since February, Sutton saw approximately 55 confirmed cases. Is that in total from February to today?
It is.
All right. And of those 55 confirmed cases, how many have fully recovered?
I'm going to say we have had a couple deaths in town, but I will also say that Maven isn't the most accurate reporting system. It wasn't designed to hold 25,000 cases. It was only designed to have 5. So initially, when everything started ramping up in March and April, there was a lot of problems and shutdowns. So a lot of the addresses weren't correct. So some of a few of the numbers in our 55 are addresses of people that lived in long-term care facilities, but they had a Sutton address, so Sutton was counted as their home, and so their death was attributed in Sutton, but even though they did not really die, did not live in the town at the time. So we have had a couple deaths.
Okay. But again, of these, most have recovered by, or at least this point?
Everybody has covered,
Okay.
except for a couple.
All right. Of the new cases, you mentioned that mostly the young people were asymptomatic.
Mhm.
Again, these are localized kids. Have you seen them, impact their families? Because again, I know that the new buzzword is cluster. Are we going to potentially see a cluster in town?
So a cluster is a cohort of 2 people. So I do have a cluster right now in town that I'm dealing with. And we picked that up by, doing the investigation of one case and where they were, who they were with. And that's how we found another case that popped up and they were together. So those 2 people, is a cluster.
Okay.
But, and then it expands after that. So the more work you do and things like that. But the biggest thing is that we've been finding is that the teenagers and the 20-year-olds have very minimal symptoms, a little bit of this, a little bit of that, or nothing at all. And the only reason why they get tested is that they may have come in contact with someone who, quote unquote, has tested positive for COVID. And that's how we realize that they get tested and they come back positive. So then they're isolated and it's reported to us and we have to follow through with it.
Okay, thank you for that last point, because that was actually my next question. Because again, I'm trying to make sense of this whole pandemic, because I think a lot of people are. And when you hear people getting tested, it was just kind of curious. So this is tied to, what is it? The contact tracing, essentially? Is that what would justify or would give somebody the heads up to go and get tested, or?
It may not. Sometimes people are concerned because they may think that they were around somebody and they may have no symptoms, so they just go and get tested. And that's when they find out that they have no symptoms, but I think so-and-so was sick, but they're not saying anything. To be on the safe side, I want to go get tested, and sure enough, it comes back positive. It's like, and they're shocked because they didn't realize that they are positive. But what we've also been seeing is that people that have tested positive just recently, I'm not sick, I haven't been anybody near sick, I don't know what's going on, but they realize maybe about a month or 2 ahead of time, they had some issues that they didn't attribute to COVID, and that could have been the disease back then. And so they're still shedding the virus, so that now that they got tested, they came back positive. So that's one of the recommendations that we don't, that we've been doing a lot of education with employers, because the CDC at one time put out, they want 2 negative tests 24 hours apart. Number one, that's almost impossible to get 2 testings 24 hours apart. And never mind 2 negatives after 14 days of isolation and or quarantine. Because we've been seeing in almost 99%, if not 100% of our cases, that people go get tested after they've been positive. They're still positive after their 14 days. And that puts them into another category where they have to be isolated again for another 7 days. So our recommendation is to, as long as you're fever-free for 24 hours and reduction of symptoms in 7 days. So we kind of keep it at a 10-day that they're no longer infectious. So,
Okay, now, I remember when we were at the high point, there was discussion on the news about testing centers. Is there a testing center where if someone's concerned, they could go to? Or is this done through their primary care physicians?
That's a good question. First of all, initially way back when, there was not enough testing or testing kits available. So if the case presented to their primary care with symptoms, they were clinically diagnosed based on symptoms. They were told to stay home. but we would have no record of it because we only get notification if they are diagnostically tested and positive, and that's when we get notified through Maven that a positive test has come in. But now that there are new testing sites that have been brought up, but there's just a new one in Worcester, there's some in Marlborough now, and those are pop-up sites. We don't know how long they're gonna be, but that gets into another issue is that if I just say, I just think I wanna get tested just for the heck of it, if I don't have any symptoms, your insurance will not cover it.
Oh.
And it's $150 or $160 for a test. So that puts a damper on a lot of things also.
It's something to consider, though, that's for sure.
Yeah, there's free testing right now in Worcester, but we don't know how long that's going to last. That's the state put that up. But, you know, I do know that Reliant and Auburn has testing sites. A lot of the Carewell urgent care clinics do rapid testing, and UMass does testing also. They have rapid tests at different times where the rapid test is, you can get a result in 15 minutes. And some of the other nasal swabs testing, and the turnaround time is starting to creep up to 5-7 days, if not a little bit more.
Okay, perfect. Thank you for that information.
Yeah.
Last general question. How much of your activity in the last couple of and tied to COVID? I mean, I know you mentioned one of Dave's questions, you've gone out, you've done site inspections, but you know, in any given day, how much percentage do you think you focus on COVID?
A good part of it, most of it, I was going to say. Even though I'm in the office, I'm multitask, so I'm doing a lot of different things. If it's for not phone calls, it's, you know, advising people, things like that. So basically everything is related to COVID in one way or another. If it's not guidances, it's working with the school, working with the self-certification for reopening in businesses, things like that.
Yeah, I'm sure. Definitely all cumbersome. And particularly in light of the fact, as you mentioned earlier, that the guidelines seem to, I don't want to say change daily, but some days it definitely has that feel.
Let me tell you.
All right, I got one last easy question for you. You mentioned earlier PPE acquisition. Generally speaking, how do you go about acquiring sufficient quantities for disbursement?
Well, unfortunately, initially I did put a request in through MEMA, and it had gone up the chain for a little bit, and then it got lost, and then it was denied. So I've been fortunate to get some supplies from the fire department, and I will say through our region, we all share whatever we have, and I've been very fortunate from the town of Charlton and Jim Philbrook, who has his pulse on a lot of things that had a lot of, got a lot of PPE. He has been very generous in donating it to the people in need. So I was able to get masks out to a lot of people that were isolated that didn't have masks, got thermometers out, things like that. Also, when we try to tell people we really want them isolated and quarantined, we've actually had people go shopping for them, pick up medication, drop things off. So to keep them in their house as much as they can if they didn't have family members or neighbors to help them out.
Perfect. Excellent. Thank you, Cheryl, again, sincerely for all that you've been doing through this. And of course, stay safe.
Thank you.
Thank you, Madam Chairwoman.
Thank you so much, Jesse. Jonathan.
Thank
Do
you,
you have
Madam
any
Chairwoman. Yep. Cheryl, just like, you know, my colleagues have said, just an amazing amount of work, and just really appreciate all of the Board of Health and all the nursing staff has done around the town. You know, and this is such an unprecedented time, and you know, I think we're all learning our way through it. And I think at times it can be quite confusing, not only for yourselves, I imagine, with all the different things coming at you, but also for the residents as well. And I think, you know, you're doing a great job to try to help people better understand that. So I really appreciate that.
Oh,
one of the questions that I have is around the active cases. So you said we have 6 active cases currently. Is that in the 55 or is that on top of the 55?
Oh, that's within the 55.
Within the 55?
Yep.
And out of those 6 current cases, you mentioned they're all younger people.
Mhm.
Have they spread that beyond into their families at this point in time, or?
We're still working that out.
Okay,
'Cause they're all fresh, they're all new cases over the past maybe handful of days.
okay. All right, and then as far as, so I've been kind of concerned about just the overall, the agreements that we have with these 11 towns, and that it would kind of overburden you and, and diminish what you can do for the town of Sutton. But I think after listening to you today, I'm kind of softening on that a little bit. I almost think it's almost an advantage in a way, because having multiple towns kind of working together and using all the different nursing staffs, I think it actually in some ways, and you tell me if I'm kind of wrong in my assessment here, but in hearing it today, I'm almost kind of reframing this as a positive, because many hands make, I wouldn't say light work, but, just add to being able to. Do you agree with that? Or do you find that having so many agreements in place is just spread you so thin?
Mhm. I have to tell you, prior to COVID, the agreements that we've had have never been an issue with me at all. So unfortunately, like you said, COVID is unprecedented. But I have to say, from the positive piece of it is that I've gotten to work with a lot of school nurses from all the towns that we have agreements with that I never really had that much of a contact with before. And we've all been very supportive of each other, and we've all formed a great alliance, so that now if anything happens within the school or the towns that we cover, we have that connection and that bond and things like that. And it's a much easier working professional relationship. And, but, like I said, prior to COVID, having those other towns were really nothing at all. And COVID's just something that just fell upon us, and that we're just dealing with and working through. So.
Yeah, absolutely. And I think that was kind of the point that I was trying to make, is it seems like that it's in some ways it's a benefit, because you have been able to create those professional relationships and work together.
Mhm.
Like, for example, with this regional grant, I think is an example of this. So, but I mean, weighing that, do you feel like in these times of crisis like this that, having these 11 towns, even though there is a benefit to it, do you find that, it's just putting so much on your weight on you that you're, what I don't want you to do is burn out, I guess is what I'm most worried about, right? Because I mean, we don't know when this is going to end.
Not anytime soon.
Yeah.
Yeah,
I mean,
I honestly, I pace myself. I know my limitations and things like that. Right now, I have 2 other nurses that are working with me, because the other nurses, ended the end of June. But it's manageable. We're working together, and we're actually planning for the fall right now. So, I think it's going to be fine. And if I think that things are going to get, too stressful or, too overwhelming for me, I'd let people know. So.
yeah, please do. Please, go to Jim or wherever you need to, because I mean, it's really important that, you're able to, manage the load. I think that's really important to me.
Yeah, I am actually looking to have somebody just be a backup for me, because right now there is no backup. But I have trained people all along, just in case, one of my colleagues said to me, Cheryl, you cannot get sick. I said, I know. So just in case anything ever did happen to me, people would know how the process works. So that's one thing that I did first thing off the bat, was that everybody knows everybody's role, so that there's no break in the action of the chain. So.
Yeah, thank you.
Mhm.
As far as, I guess, what has the caseload been across? So we've talked about 55 cases in Sutton, but you're managing 11 or 12 towns. Do you know offhand how many cases across all of the towns, including Sutton, that you've been dealing with?
No, I honestly don't. I will say Millbury is pretty high, only because Millbury has the nursing home, and there was an awful lot of cases that came out of that nursing home early on. But other than that, I really couldn't tell you, because a lot of the towns that have their own nurses in, I just do the overseeing of it, so I don't I just monitor the cases from a distant. So, I mean, I could pull that figure, but it's in the thousands. It's a couple thousand anyway, from start to where we are now.
Okay. And do you know, like, I mean, in the case, I've heard this over and over again with these nursing homes having high numbers of cases. Do you know if there's any active investigation into like why that happened in such a large scale?
Unfortunately, I think it was brought in because that's what we had been seeing. Cases from people within the community going to work, not realizing what they had early on, because the symptoms are so general. They can cover a random amount of illnesses and diseases. And so when they went in there, you've got frail patients with a lot of comorbidity and age. And so that was, I think, a big thing of it. But right now, because you know, since the National Guard came in and the state mandated testing, a lot of nursing homes now, and we do have like maybe a handful of nursing homes in all the communities that we cover, they are now tested on a regular basis. So patients, staff are all tested weekly or bi-weekly in all the nursing homes. So.
Right, thank you.
Yeah.
And I think the final question, I mean, my colleagues have asked a lot of great questions, so I don't want to repeat any of those, but I think the final question that I have, and again, this is around clarity. I think this is clarity for the public.
Mm-hmm.
So we talk about 6 feet, you know, social distancing. And then, so the question I have with that is just clarity around, like, if you're 6 feet from someone, should you be wearing a mask? Because I know, like, you know, I saw a lot of questions, like I was on some of the school calls, and kids are going to be 6 feet within their classroom sitting at their desks, but they still have to wear a mask. Then in the kind of outside that, I'm hearing like, if you know, 6 feet, you don't have to wear a mask. So can you bring some clarity into that? Because I think it's just adding to the confusion for people. And so.
Mm-hmm. So basically what we're trying to promote is that you wear a mask all the time. That's huge. One way or another, either you going out, coughing, sneezing, protecting yourself, protecting others, whatever. But also the mask is very important, and the 6 feet is considered a close contact. So we consider a close contact somebody less than 6 feet for greater than 15 minutes without a mask. So that's considered a close contact if somebody in that realm of them becomes positive. But masks are recommended all the time just for the protection, because if somebody sneezes, the sneeze goes beyond the 6 feet. And sometimes a cough can also extend the particles beyond the 6 feet. So a mask is really recommended everywhere you go. I know in the town hall, hallways, public places, masks are very important. Masks, distancing, hand washing, it all goes hand in hand. And we really do see a difference when it's all in place. And what I want to say to that, I know you're referring to school, is that I'm in the school now. Like I said, I know there's special ed going on for a couple weeks, as well as Title I reading within the school system. Those desks are placed 6 feet apart. The kids all have masks on. I'm working in summer care. We've been 6 weeks into the program, and 5-year-olds all have masks on full time, and they're doing fine. And it seems to be working well. So it's a lot of work, but everybody's doing the best they can. So we'll see where everything goes.
All right. Well, thank you. Thank you for everything, and take care. So thank you, Madam Chairwoman. I'm all set.
Thank you so much, Jonathan. Jeffrey, did you have any questions or comments for Cheryl?
I did. Thank you, Madam Chair. Cheryl, again, I'll just add my thanks. And really not only my thanks, but I'm sure the thanks of everyone in town, because I think everyone is pretty much aware of all the work you're doing. So thank you for that. And, you know, I was very...
No, Jeff muted himself.
Jeff, you're muted.
Okay. I was very much looking forward to you coming in to this, into meeting with us, because I thought it was important just to go over protocols within town for all the different, whether it's schools, restaurants, in town. And John, to Jonathan's question about the masks, because you know, you mentioned early in when you began talking to us about, you know, you can kind of suffer from quarantine fatigue. And I think a lot of us have, you know, are there, and you kind of forget about all the different requirements. And one of the ones that I hadn't really thought about until you mentioned it was the new regulation regarding quarantining when you're coming from hotspots, and how that might play into students and or teachers that may have been on vacation at the end of the summer outside of New England. I assume that means that they don't go into class. Is that how that's going to work?
So what that is that, first of all, it's a mandate. But again, we're hoping that people self-identify because we don't have eyes 24/7, things like that. And we also have people that, you know, will tattle on people. So we're just asking people that there are forms that are on the website that I have, and that they're all over airports and things like that. And I do think that you need to be responsible for your actions in regards to this pandemic, and to acknowledge that you've been to a hotspot and that you should be quarantining. And that as far as school goes, I do believe that anybody that, you know, comes into that comes from a hotspot needs to quarantine. And I think that's the right thing to do if you're not even asked for it, to let people know that you need to be home for 2 weeks and go from.
And you also mentioned
Jeff, I'm working. Jeff, man.
Sure.
Yeah, I just want to say that I'm working with town council to develop a policy. Town council has gotten a number of requests from various towns about the governor's recent order forcing quarantine. So, you know, we have individuals, either school personnel or town personnel, that want to go to some of these hotspots and for vacation. But we are looking to develop a policy that looks like when they return from their trip, they can either self-quarantine for 14 days, and get a test with, then they can return to work. So we are working with town council on all the legal stuff, and we should do that within a day or two.
Okay.
Thank you.
And Cheryl, you mentioned also about fall sports not really being allowed. Is that a decision that's been made through with the governor, the MIAA, or?
The fall sports, certain contact sports were related to risks. So the ones that I mentioned, the high contact sports, football, hockey, lacrosse, soccer, things like that. High contact, where you're having contact with people, where you're sweating, things like that. Easily transmission, no masks, things like that. Those are in the guidance for phase 4. And that was way back when all the phases came out. And phase 4 is not going to be available until a vaccine is there. So, but I do know that the school organization has set, I believe, September 13th as to beginning of sports. But I do believe that some of the towns that I've been in dealing with their reopening plans, that they're going to take their own local action in regards to the sports. Because from my personal professional perspective, playing sports and getting back into a closed environment, and you having cross issues of cross county, who knows who you've been with, things like that, and you have a little outbreak. What you see right now in Major League Baseball is pretty significant. So I think that's still up for the debate. And like I said, the guidance changes every day, and that's a month away plus.
Okay. And just two more questions. And this one, Jim, you might be able to help on the PPE. Some supply, do we have adequate supplies for public safety and/or schools?
I believe so. We have utilized the CARES grant as well as the FEMA to get that supply. Matt Belcito has been a great resource, as well as Paul Maynard. Their connections to MEMA, as well as the Matt Belcito is the, I believe he's the former chair or maybe current chair of District 7. So they've got a lot of connections, and that bodes well for the town of Sutton.
Okay. And the final comment I had, a really question, may or may not be a question, is I went to a restaurant recently for outdoor dining. It wasn't local, but they had me. They took my name and phone number to be able to do contact tracing. Are we doing anything like that, or is that a mandate anywhere?
No, I believe that was their guidance, but it is not a bad idea at all.
Okay.
Just in case somebody, whether an employee or a patron, things like that, at least, you know, there are some times and local people, distance, things like that.
Okay.
But I also do want to get back to you regarding PPE,
Yep.
only because I'm involved with the school also in their reopening. The school has a lot of PPE that they were able to purchase.
Oh, good.
So,
Okay.
I think Roger Raymond and Michelle Donovan and the other nurses, there was quite a bit of PPE.
Great.
So we'll see how it gets used, but yeah.
Okay. And thank you again for coming in. It's been very helpful, I know, to me and hopefully to my colleagues and those watching us. So thank you.
Oh, you're welcome.
And that's it, Madam Chair.
Thank you so much, Jeffrey. Cheryl, of course, like my colleagues, I want to give you my great thanks. You've been very humble. We're all well aware of the amount of work that you've put in. I do have a couple of questions, and if these were asked earlier when I was having some connection problems, please let me know. With this cluster that you were discussing with the younger group,
Mhm.
how is it that you came to know that they were positive if they weren't showing symptoms?
So anytime anybody gets tested and it becomes positive, that's automatically sent electronically from the lab to the State Department of Public Health.
Mm-hmm.
They in turn send it back to the local Board of Health where the case lives. So that's where that comes from. So that's how I know they were positive. So during our investigation, during our calls with them, during our contact tracing, is where we find out where they've been for the past couple days, week before, who they've been with, where they've worked, where they've partied, where they've vacationed, things like that. So we have that information. And then because there's just 2 of us nurses, so the town, when we get another case, that's how we know that was related to like a baseball team, which I'm dealing with now from another town, that the nurse that covers that general area had called me, and that's how we share cases also. And that's how we form a cluster.
Do you have any idea, firsthand knowledge, what precipitated the first individual to get a test? I mean, was he showing symptoms? Is that why he went in and got the test, which turned out positive?
That I really don't know whether that person, what the reason was for it. I mean, they're all starting to blend right now, so I can't differentiate between them. I apologize.
Yeah,
But usually sometimes it's, you know, they've been in contact with someone that, oh, I hear so-and-so's positive and I was partying with them, whatever, maybe I should just get tested, things like that. Or they start coming down with some symptoms and they seek to get tested. So there's a lot of different things. I'm dealing with a bigger cluster in another town right now that's involving 20 people, so.
oh my gosh.
And they had a COVID party. They specifically said it was a COVID party, so.
Good Lord. With these, the smaller cluster here, do you know, and again, I apologize if this was already asked, if anyone else in the household has active COVID symptoms?
We're still involved in the contact tracing right now because it's early in the game right now. So we really haven't been able to put all those pieces together.
Okay. I did have a,
In other towns, we have picked up on that, how it's been traced back to the family members.
okay. Yeah, scary.
Yeah, and then we do advise them to get tested because they may not be tested, but just listening to them, talking to them, things like that. Sometimes the cases are minor, so we have to speak with the parent and we can pick it up in their voice, that cough that they have, or some of their symptoms, things like that. That's when we recommend that maybe they get tested, and we instruct them how to isolate and quarantine and how to self-identify to their employer. But a lot of people are reluctant to even give us their employer, or they're reluctant to give us who they've been hanging around with. So there's a lot of different scenarios. So we try to pull them out in different ways, shapes, or forms. So
Sure. I know this probably seems like a very Orwellian question, but what is your right to enforce any parts of this pandemic about getting tested, providing tracing information, wearing a mask? You know, what is your authority here, and what do you see it as being going forward?
mm-hmm. Well, we do have the authority. The Board of Health does have the authority, also with the police department, which I've also released some powers to enforce mask policy. We really don't want to be punitive and fine because the mask policy is $300 per incident, but we just want them to comply. But there are some people that we know that, you know, don't want to comply, can't comply, things like that. We just try and be mindful and do our best. But, you know, there has been some cases where people are just belligerent because it's their right and things like that. And, you know, we don't like to cause confrontation in a public establishment or things like that. So we just try to do the best we can to do that. And the same thing with the mandatory quarantine, which is $500 a day.
Oh, wow.
Upon return from a hotspot that started on August 1st.
Well, your efforts are greatly appreciative, not gone unnoticed. I have one question, Jim, I think for you. With the CARES Act, can we purchase PPE and then do we get reimbursed, or is there a certain amount that we're given up front to purchase PPE?
No, well, it's actually a two-step process for PPE. We have to apply to FEMA first, and FEMA reimburses us 75%, and then we can go to the CARES Act for the remaining 25%. So it is a, you know, typical federal government paperwork challenge. But you know, Tim Harrison's kind of running that for the town and doing a great job. So I leave it to the expert. But yeah, that is the challenge. It is a two-step process. It's not as simple as applying for the CARES and getting reimbursed.
Excellent, thank you. Cheryl, thank you so much for being here tonight. I know that the community is also very, very grateful for your input.
Well, thank you.
Chairwoman, can I just ask a couple of quick follow-up
Of course, David.
questions? Cheryl, one question I have on the contact tracing, what kind of cooperation are you getting on those?
It's interesting. I can't say it's all good and I can't say it's all bad. It depends. Some people are reluctant to even tell you where they've been or who they've been with, so you get no information, even though you can kind of surmise that they're not being very forthright and upfront with you. Other people have been pretty good. So it really depends, but we really try to stress the importance of the reason why we're doing contact tracing. It's not punitive, it's just to help to stop the spread of the disease more than anything else.
Okay, unrelated question, but you mentioned earlier about the importance of wearing masks. And just for clarification, you know, we're fortunate enough to live in Sutton where we get a lot of open space. And, you know, one thing that I've noticed early on still seems to be the case, but there's an awful lot of people that go out for walks out of doors. people out running, people out riding bikes. Do you think masks are necessary in those circumstances when people are outside and not with other people? For anybody that's watching, we may have lost power with Town Hall.